Great pleasure to have the honor of getting us started here at SAGE's 2012. I think it's going to be the program committee has put together a great meeting, and we're excited to get started with the postgraduate course. Of course, and the most important thing, which is colorectal surgery. So there are a couple things I'd like to point out. I think we have a great faculty for you, and we're going to try and highlight some of the issues and highlights that exist in minimally invasive colorectal surgery. Please let us know if you perceive any conflict of interests in the talks. I don't think that's going to be an issue. All the speakers will have their disclosure slides. We're trying something new this year with the texts and the tweets, and you can see it's postgrad colo in your message to 2333. Is the explanation to do this, and you'll have to bear with us as this is going to be a little new for all of us. Can I have my slides for the introduction? So that's Jeffrey Marks, and that's not me. So it's really my pleasure. My name is John Marks. I'm from Lankenau Hospital in Philadelphia. I'm the director of this course. We have with Michael Stamus, who's the chair at UC Irvine, and Peter Marcello is another co-director from he told me he's now the incoming chief of colorectal surgery at Lahey. And so here we go. So really what we're talking about is some of the challenges that still exist for colorectal surgery in a minimally invasive approach. We're not queuing here, guys. Okay. So really, in many ways, colorectal surgery from a laparoscopic approach is old. It's been 20 years now since this was first done. However, when we look worldwide, maybe with the exception of Korea, the uptake is always less than 20%. And so what we wanted to ask ourselves, is this a problem with the airplane, or is this a problem with the pilots? And we as a group got together and thought that what we would do is focus on some of the problem areas that still exist, look at it from the different modalities of approaching it, SILS versus robot versus laparoscopic, and also employ some of the more advanced endoscopic challenges. Because clearly in 2011, there's a patient who had an appendectomy scar here. This was a year after they'd had a left colectomy done through a SILS port. And so there's still a lot that we can do. And so to get us started on that, I'm going to ask Harry to come up to see us. Harry is one of our, is really one of the leaders in the world of, comes to us from Texas. That's right. And he's going to be speaking to us on SILS operations and the instrumentation.
Great. Good morning, everybody. Got a nice bright light in front of me, and I can't really see you, but I at least wanted to ask let me see, how do I advance? Just hit the green.